I got diagnosed with lymphoma about like the first week of the year.
Dustin Allen is on his way to recovery after starting chemotherapy in March.
I had a lymph node that was right there that was like inflamed for like 6 months, and it took forever to get like a diagnosis. And so I ended up having 2 lymph nodes removed, and they came back with lymphoma. So I had a total of 3, so I've got 1 more right about down here that still needs a little bit more treatment.
Allen is halfway done with his chemo treatments and hopes to be finished by the end of June, but says with the continued shortage of medications out there, there's a chance it could be prolonged.
So hopefully we have enough left over that I can get my treatments. Honestly, I don't know what the next round would be if there wasn't the drugs.
His doctor, Rupesh Parikh, says the shortage is often manufacturing related, but many of these drugs are also generic, so only one company makes them. Oftentimes, there's not enough to keep up with the demand.
It's become a little challenge for us, in taking care of our patients. So all those discussions we have with patients, we tell them up front that, hey, there's a potential that halfway through your treatment, we may not have the drug. And that's the scary part of all this.
If the medication is on an extended delay, that's when doctors start looking at other treatment options, which is not always recommended. And Dr. Parikh says in his 20 years of practice here, he is seeing a startling trend when it comes to 2 specific types of cancers.
We're certainly seeing a trend, more younger patients. We're seeing a lot more colorectal cancer specifically. We're seeing an uptick in younger breast patients as well. Those 2, I think, have really gone up in the number of cases we've seen.
Dr. Parikh says that while there have been some chemo drugs to bounce back from the shortage, it continues to be an ongoing cycle with new drug shortages popping up unexpectedly.